According to recent reports, low back and neck pain ranked number 2 as the most costly health condition in the United States. In spite of the advances in surgery and pharmaceuticals, we are no closer to a cure than Hippocrates in 400 BC. Scientists are really not surprised, considering that back pain has never been the result of a drug or surgical deficiency. But the fact remains, just because you don't need surgery doesn't mean you don't need treatment. In the past 30 years, a new and safe alternative to conventional medical treatment has emerged called non-surgical spinal decompression. A very few conservative options have consistently demonstrated the pain relief benefit of this new and innovative pain relief technology. Millions of men and women have benefited naturally from this non-invasive procedure called NSSD and finding relief without surgery. Combined with strength restoration therapy, or SRT, back pain can now be managed, reduced, and often eliminated. While not all surgeons share the optimism of this non-surgical back pain protocol, the real litmus test is overwhelming patient satisfaction. Some physiological facts are not open to well-intended opinions. Compression and spinal weakening affect everyone, everywhere. There is simply no escape. We all stand or sit 2/3 of our lives. Spinal compression and weakness increases with age. Physiologists call this time under load. Another fact is that the spine is only as strong as the muscles that support it. Therefore, unless we maintain spinal strength, we become unstable. Muscles help hold our spine in alignment. If we aren't getting stronger, then we are getting weaker. Loss of muscle strength can only be reversed through muscle-specific exercise. Eventually, compression and weak back muscle produce instability, erratic motion, and nerve pressure. Over 98% of mechanical spinal pathology starts with a decline in mechanical support and results in what we call back pain. Since the early days of vertebral axial decompression, there have been many advances in equipment design. Early researchers recognized there was a distinct difference from old-school traction and the advanced method of decompression. Inconsistent and unsatisfactory outcomes from sustained static traction led many practitioners to believe the procedure was ineffective. Early decompression pioneers discovered that it was an appropriate procedure inappropriately applied. Sophisticated computer formulas, programs, angles, and positioning brought traction decompression to a new level. Some machines placed the patient prone, others supine. But regardless of the manufacturer, they all agreed on the need to create a negative force within the disc by distracting the vertebral column. This rhythmic action has been speculated to create a vacuum, causing an imbibition of fluid back into the disc. Some scientists believe this rehydration process restores synovial fluid into the articulating facet joints as well. A 2006 report in Spine Journal concluded that disc distraction showed evidence of regeneration potential in degenerated discs. Unlike conditions with standardized treatment protocols, selecting back pain treatment can be confusing. Sometimes that is merely seeing the closest doctor or ER, or a process of elimination. The one thing all back pain sufferers are searching for is the elimination of pain. Generally speaking, the two common threads shared by people with back pain is a decline in stability and increase in compression. Many scientists believe that until those two issues are addressed, all other attempts at a cure are futile. One of the pioneers in decompression and strength restoration therapy was a small group of research physiologists in Houston, Texas. Funded by the Lordex Corporation, this scientific team demonstrated the positive outcomes derived from this remarkable non-invasive and natural approach to spine care, but the price of progress is never cheap. The new surge of competitors built highly sophisticated machines, costing hundreds of thousands of dollars, making treatment access to patients often unaffordable. The investment requirement for private practitioners drove the cost to patients as high as $10,000 in some clinics. Many doctors initially excited were unable to provide their patients with care. In addition to equipment cost, employee time had to be factored into the equation. Procedure setup time was time-consuming and expensive due to the application of harnesses. As such, patient care and scheduling availability was limited. Today, the innovative and technology-driven pioneers of decompression, Lordex, have created a new and affordable way to deliver the benefits of natural decompression and strength restoration therapy. Called the Lordex Super Chair, this elegant, comfortable, and ergonomic design incorporates robotic engineering and simplicity. By eliminating harnesses, technician time, and space requirements, the Super Chair is the affordable choice for practitioners today. Decompressing in a relaxing supine position, the added massage and heat features puts the Lordex Super Chair in a class of its own. But most important is patient care. The affordability of the new Lordex Super Chair is destined to make the availability of care for patients grow exponentially. The advanced technology used in the Lordex Super Chair has the potential to bring affordable back pain relief to the 30 million men and women who wake up with back pain every day. The Lordex Super Chair robotic features, innovation, and improved outcomes enhances patient experience and saves valuable clinic time. Together, the Lordex Super Chair and the Lordex Back Builder make up the Lordex Spine Care System. Before believing drugs and surgery are your only options, think natural, think Lordex.